system chapter. What we're going to do with this one is very similar to the skeletal system, where the first thing we're going to do is go over all the muscles that you guys are responsible for your lab practical, and then we're going to come back and kind of look at some terminology and kind of look at the physiology of the muscular system. But this way, you guys can get into kind of starting to practice your labeling and making sure you're ready for the practical. Okay, so the first thing you always want to do, and again, we did this, excuse me, with the skeletal system, is you just want to take the general photo here of the muscles, and you just want to see kind of what you know already, right? So you want to see if you can find the bicep, and you can find the tricep, and the deltoid, and the pectoralis muscle. A lot of people, especially if you've worked out, when you're in high school or when you were playing sports and things like that, or if you work out now, you're going to be familiar with the general muscles, okay, just from exercises and certain things that we've kind of done in the past. And then what we want to do is just kind of elaborate on that. So again, the first thing you want to do when you look at a picture is find the front, find the back. So at this point, I know I'm looking at the front part of the body because I can see the face here. And then again, I can say, okay, what muscles am I going to be able to sort of see if I'm looking at the anterior part of the body? So we find our quadriceps, we find the bicep, we find some of our abdominal muscles, pectoral muscles, and then we want to do the same thing when we're looking at the back. Okay, so you want to find like latissimus dorsi, find the trap, deltoid, triceps, glute muscles, get the general terms, and then again, we're going to look at some of them a little more specifically because some of these muscles, they have more heads or they have more parts that kind of make them up. And with that, we know the bicep is going to be made up of two. The triceps going to have three heads, the quadriceps are going to have four. So we want to be a little more familiar with sort of what makes these muscles a little bit different from each other. Okay, but this is the very first thing I want you to do is just go through and identify the main muscle and kind of see if you're familiar with those or if you want to spend a little time just kind of going over those a little bit too. Okay, and then with part one of this audio lecture, we're going to look at the head and the spine, and then we're going to look at the upper extremity. Okay, so here's a picture of the face and the head and the neck. And again, we don't have time to go too deep into all these muscles in the head and the neck because it does get pretty complicated. So I'm going to show you kind of the ones that I want you to focus on, okay? And it's going to be these ones here. So we want to know the temporalis muscle. We want to know the masseter muscle. The temporalis, if I put my fingers on the sides of my head and I kind of bite down with my jaw a little bit, I'm going to feel that temporalis muscle contract right on the side of your skull there, kind of where your temples are. Masseter muscle is going to be the same. If I bite down, I'm going to feel on the side of my cheek, I'm going to feel this muscle contract. These are two like big headache muscles too, okay? So if you get a lot of tension headaches or, you get a lot of just headaches in general, a lot of times this is where you're going to feel a lot of that tension and this is where you're going to feel a lot of that discomfort, especially if you're one of those people where you grind your teeth or you chew gum or you do things like that where you kind of hold that tension in there. These are two of the muscles that are going to be very tight. Okay, so we're going to narrow it down, make sure you know the temporalis, make sure you know the masseter. When we look at the front part of the neck, and again, I know it's the front because I can see the teeth here. You get a couple of different muscles that are important. You get this big, huge one here. There's not a lot of muscles in the front part towards your throat, but the one that is really important, okay, is going to be this sternocleidomastoid, and it's actually got the two parts. So I can see the one part here, and I can see the one part going down by the clavicle. But the name kind of tells you where it goes to and where it kind of starts with, right? So it goes to the sternum, and then your mastoid is again going to be that big, huge bump right behind your ear. And again, I can find that bump behind my ear and I can follow this muscle with my fingers all the way down into the front where it attaches to my sternum. And a lot of times this is going to be a muscle that's going to be really tight in a lot of people too, okay? Especially now that we're on the computer a lot. You have all these kids playing video games all the time where they're just in this flex position, and it's going to make these muscles in the front, get really tight. The other thing I want you guys to do is a lot of muscles in the body when I'm looking at what are their functions. I'm going to be able to know what their function is based on their location. So this is one of those ones where because it's in the anterior part of my neck, it's going to be a flexor, okay? And you're going to find this with all the muscles in your body. If they're on the posterior side, they're going to be an extender. If they're on the front side, they're going to be a flexor. If they're on the lateral side, they're going to abduct. If they're on the medial side, they're going to adduct. And what this does is it kind of keeps me, there's always, muscles that don't follow those sort of rules, or there's always exceptions to the rule. But it gets where I don't have to necessarily memorize everything, right? I can just be like, okay, I know my quadricep is on the front part of my body. This is what all those muscles on that anterior side. So we're going to kind of look at those two and try to make it a little bit easier to sort of, memorize, know what the muscles do and know what the functions are without having to go back and kind of memorize everything. The one other important thing I want to mention is that when you're talking about the function of a muscle, you always have to specify what joint you're talking about. So like if I think about the bicep, it's going to have an action at the elbow and it's going to have an action at the shoulder. So I want to say, hey, my bicep is going to do this at my shoulder. It's going to do this at my elbow, because sometimes the motions are going to be a little bit different. Okay, so we just want to be real specific and make sure everybody knows exactly what we're trying to say. Now, if I take off the sternocleidomastoid, I can see these muscles underneath here, and these are going to be my scalene muscles. So I'm going to have an anterior, I'm going to have a middle, and I'm going to have a posterior. These ones not super important because they're kind of smaller muscles, but the one thing you will find with people if they're having cardiovascular kind of problems and they're having breathing problems is that these will start to get really developed, because you can see that they're attached to my ribs here. And people, if they're having trouble breathing, they're having trouble kind of getting oxygen, what they'll do is they'll start to try to use these muscles to increase that amount of oxygen, and these will get kind of overdeveloped. And sometimes that's one of the very first things that'll kind of tell you that they're having some other issues. Okay, so you always want to look at, what things will point to other issues that somebody might be having. But again, anterior part of my neck, sternocleidomastoid, and then I have my scalene muscles, and then I can see that, this is there's not a ton of muscles in that front part. It's mostly just my trachea and just, I have some nerves and some arteries that are going to flow through here too. So it's actually a very sensitive kind of area in that front part of your neck. Okay, so now we get to this is the back side, right? Because I can see the back of my skull. I can also see my scapula, right? And I can see the spine of the scapula. So that's going to tell me I'm looking at the posterior part of my body. And these ones are, they look really complicated, but they're pretty simple, because I basically have 3 erectae spinor muscles. And these are the ones that are going to keep me standing up. They're going to erect my spine or keep me standing up tall. And I'm going to have 3, and they're going to start in the middle, and then they're going to work their way a little more laterally. And I'm going to get the spinalis, okay, that runs down the middle. If I go a little more laterally, I'm going to get the longissimus. And then if I go even more laterally, I'm going to get this iliocostalis. And that one's easy to remember because it gets out more towards the ribs. And we have, costal is always going to mean my ribs. So we want to know that these are the erector spinae. We want to know the 3 names just based on sort of where they are located in the spine. And then the only other thing that's going to change is that based on where they're located in the spine, it's going to add one more term to the name. So if they're in the lower back, they're going to be a lumborum. If they're in the middle part of the back, that's going to be my thoracis. And if they're up in the top, they're going to be a cervicis or a capitis. So cervicis is going to mean the muscles are going to be in your neck, and a capitis are going to be muscles that are actually going to come up and they're going to attach to your skull. So the name kind of tells me how close they are to the spine versus how lateral they are to the spine. And then the last part of the name tells me, are they in my cervical spine or my neck? Are they in the mid part of my back? Or are they in the lower part of my back? Okay, quadratus lumborum over here is going to be another muscle that kind of attaches to your pelvis. Another really important one. And again, anything that attaches to your spine or comes up and attaches to your pelvis are really important muscles, because what happens is when they get tight, they start to pull on that spine and they start to get your joints in all these positions where it can start to really deteriorate your back over time. Okay, and we're going to talk about sort of which muscles are most commonly tight and sort of what we should do to sort of keep those loose and keep our back in a good position. Okay. Alright, so now we get to the front part. So some of these we're familiar with. So we have our rectus abdominis, okay, that's going to be most superficial. And again, all your abdominal muscles are it's layers and layers and layers. And this picture does an amazing job at showing you, okay, this is my superficial layer, rectus abdominis, right? If I take that off, what am I going to see underneath, right? And then so on this side, I get my external oblique, right? Underneath that, I get my internal oblique. Underneath that, I get my transverse oblique. Okay, so and really, a lot of people do sit-ups and things like that, and they kind of work this rectus abdominis. My son's always talking about, does he have a 6-pack or an 8-pack or a 2-pack, or what we've learned over time is that these muscles, this one particularly, is not super important, and that we're always kind of really strong in this rectus abdominis anyway. And the whole 6-pack, 8-pack, whatever pack you want to talk about, it's really more about your body fat versus how strong you are or how fit you are. These are the ones that we want to really focus on. Is this external oblique, internal oblique, transverse abdominis? These are the muscles when you're working your core. These are the muscles that we're working on, and these are the muscles that are going to keep your spine in that nice good position so that we don't start loading up our discs and our vertebrae and all the cartilage and all those different things. So these are the ones these are the key to kind of working out and keeping your back healthy over that long period of time. Okay, we don't really need to sort of do the normal sit-ups. This is where we want to do our bridging, we want to do some planks, we want to do some front planks, we want to do all these different things with the physio ball, and we want to try to keep these oblique muscles and this transverse abdominis really strong because again, these are the ones that are going to stabilize my spine for me. Okay, and this picture is really great because it kind of shows you that all these muscles are kind of running in different directions here. Okay, so I get my internal oblique, my external oblique, I get my transverse abdominis. Again, a lot of these will go with kind of the planes that we talked about before. But these muscles, you know, the reason we have all these layers and the reason they're all running in these different directions is that they're going to allow you to respond to these forces coming at you from all these different directions. And you can think about your low back and your spine and just, you know, how many times do I have to correct and keep my balance when I'm slipping, I'm following, I'm climbing stuff, I'm stepping down from stuff, I'm jumping. There's going to be a lot of forces coming at you from all these different directions. So this is why we need these three. We need them to run in different directions so that they can keep me in this nice stable position, and we need to keep these ones really, really strong. Okay, and this one is a good one because again, I can tell which one's which a couple different ways, but the easiest way is just to kind of look at the fibers and to realize that okay, they're kind of running in all these different little directions. So now we get to sort of the shoulder and the chest and that upper extremity. Okay, I can still see from this one my sternocleidomastoid. I can find my clavicle, I can find my sternum, so I know I'm looking at that anterior part of the body. And then these pictures are great because on the one side they show me superficially, if I just took the skin off, what am I going to see? And then if I take that first layer of muscle, what am I going to see under that? Okay, so once you take the skin off, I'm going to see my pectoralis major, I'm going to see my deltoid, and then I get the first look at that bicep here. Okay, if I take off the pec major, underneath that I'm going to see this pectoralis minor, and then I'm going to see a couple other muscles that kind of go with the arm and the shoulder and things like that. Okay, so pectoralis major, deltoid, bicep. I take off the first layer, I get my pec minor, and then I get this serratus anterior, which we'll see down the line a little bit, and then I start to see some of the muscles that you're in the shoulder that we're going to look at here in a second too. Okay? And this is exactly what I want to do. Get the picture, identify the main muscles, and we want to be practicing our labeling. Okay, so now we look at the back side. So the back's a little more complicated. Again, I can see the scapular spine, so that tells me I'm looking at the back side. But again, if I'm looking at the posterior part of my body superficially, I'm going to see my trap. Most people only think the trap is this little section up here, but your trapezius is actually a big, huge muscle. So it goes from the back of your skull all the way to that point in your shoulder, and then it goes almost all the way down to your lower part of your back, okay? And as it gets tighter, you'll start to get kind of spasms and tightness in this whole muscle. You know, it usually starts off in one spot, but then as it lingers, it starts moving around to all these different parts too. So very, very big, huge muscle. Covers a lot of spaces, okay? I can still see my deltoid. I get my first look at my latissimus dorsi here, and then on this side, I take off the trap, and I get to see a couple other muscles here. So I get to see this levator scapula. This one's going to blend in with the trap a lot of times, and people that have neck pain are going to have a lot of tight trapezius muscles and tight levator scapula muscles. This muscle is nice because it tells you what it does, right? Levator scapula, you can see it holding onto that corner of that scapula there. It's going to lift up that scapula, okay? From the spine over to this medial border here, I have all these other muscles that are really, their main job is to just control what my scapula is doing. And again, they're trying to provide this stability as I'm kind of moving my arm, okay? So I have muscles that move my arm, and then I have muscles that actually just move my scapula and stabilize my scapula for me. So these rhomboid muscles, again, which are right under this trap here. And again, I can find this medial border on myself, or I can feel it on, palpate it on somebody else. And I can kind of feel all these muscles kind of coming and attaching here. And again, this can be a point where people get a lot of tenderness and a lot of pain too as they, you know, our shoulders get real rounded forward, our head gets really forward. And what happens is we stretch these muscles out all the time and they just kind of keep pulling on this medial border of the scapula. And then I can get a lot of discomfort, especially right at the corner here. You know, if you find that corner of the scapula and you just put your thumb on there, a lot of times it's really, 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 really tender. Okay, so I get two muscles, rhomboid minor, and then I get the rhomboid major. When you're talking about muscles, you know, a lot of times you'll have a minor and a major. The minor is almost always going to be a little more superior, and the major is always going to be a little bit more inferior. Right? The other thing I get to see in this one are the back part of my rotator cuff muscles. So again, I found my scapular spine, and we said I have a supraspinatus fossa up top, and I have an infraspinatus fossa below, and then I'm just going to put those muscles in there, right? So I've already learned the fossa in the skeletal chapter, and now I know, okay, what goes in there is just going to be that muscle. So supraspinatus, infraspinatus, I get two more muscles with a major and a minor. I get the teres minor here, and then I get my teres major. The rotator cuff muscles, you know, their main job, we're going to look at them in a second here, but their main job, again, is just to hold that humerus here in the socket, okay, and sort of position it and allow me to sort of move my arm around and be real stable as I'm using my bicep and my deltoid and my traps and my latissimus dorsi to kind of put my arm in all these different positions. The question that comes up all the time is which one is not a rotator cuff muscle, and it's going to be this teres major, okay? Because again, it's got a little different attachment. But again, at this point, we just want to be able to label everything and just be able to sort of identify all the major muscles that kind of make up all these different groups. And again, you want to be like, okay, if I'm looking at the back part of the scapula, what am I going to see? If I'm looking at the posterior part of the body, what muscles am I going to be able to kind of see? This is where those anatomy coloring books, they become really, really, really handy too. So if you guys had purchased one, or you can find one online super cheap and kind of print them out and color them and label them, they can be really, 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 really helpful. Okay, so now we get to the front part of the arm here. Okay, and we're going to have a zoomed in picture here in a second too, but I get to see my scapula here, and I can't see the spine, I can see the clavicle. So again, I'm looking at that front part of my arm or my shoulder, okay, and I get my bicep muscle. And we learned some of the, the landmarks. We had our coracoid here, and now we get to see, okay, why is that so important? It's because one of these heads of the bicep is going to come up and attach on that coracoid. And with the bicep, I get a short head that's going to attach to the coracoid, and I get a long head that's going to kind of run around this whole bone and attach a little higher on that scapula. And again, it's going to be the long head, and it's just the one that's a little bit longer, okay? And it's the one that's going to get damaged all the time because, as you can see from the picture, it kind of runs up right underneath that acromion. And then as my arm gets unstable and my rotator cuff muscles are not working properly, this bone's going to creep up and I'm going to impinge everything, and eventually I'm going to tear this little muscle here. So most people, if they tear the bicep and they come in, they'll just have this whole muscle will be all balled up in their arm and it just, not functioning anymore. It's usually going to be that long head just based on that position, okay? And then the bicep crosses the shoulder, so we know it's going to move the shoulder, so it's going to be a flexor of your shoulder. We can see it crosses my elbow here, and we know it's going to kind of flex my elbow for me. But again, because it crosses both of these joints, most people know it moves the elbow. They don't realize that it has a function kind of up at the shoulder too. But that's where we're going to come back to the origin, insertion. And when we look at pictures, if a muscle, if it crosses a joint, you know it's going to do something at that joint, okay? So here's another picture of that front part. Now we're taking off the bicep. We get this other coracobrachialis muscle, okay? And then we learned brachialis just based on our terminology, and we sort of know what part of the body it's pertaining to, right? And then we get this front rotator cuff muscle here, okay? Because we had the 3 on the back, we get the 1 in the front, and this is going to be that subscapularis. And you can see it's almost as big as the infraspinatus and the supraspinatus put together, but there's no spine in there, right? But this is the one that's going to do the same thing. It's going to hold this humerus in that socket, but it's going to do it from that anterior side. And again, this is resting on the back part of my ribs and has to kind of slide up and down, which can cause some problems too if it's not sliding on that rib cage really, really well. Okay, so now we have the back part of the arm. We saw supraspinatus, we saw infraspinatus, we saw the teres minor, we saw the teres major, we saw the latissimus dorsi already, right? But this is a good picture because it shows us our tricep. And then, tricep tells you there's going to be 3 heads, just as the bicep told us there was going to be 2 heads. In this picture, you cannot see the medial head here. You can only see the long head and the lateral head. The long head is going to be the one that just runs up higher where it attaches, or it's a little longer, which is how it gets its name. And then the lateral one's going to be on the lateral side, and then again the medial one's going to be more towards that medial side. Right? But I get these 3 heads, that are all going to come down from this one big tendon that's going to insert on that very back part of the big bony spot on your elbow. Okay, but tricep, again, I got my 3 heads of my triceps, 2 heads of my bicep. And then here is a picture of all your rotator cuff muscles, and we're just going to take a look at sort of what happens. But I can see the supraspinatus here, and I can see that it's underneath this acromion. And again, all these muscles' job is to hold this bone in the socket, and when they get fatigued or they get injured, it just can't do its job. And this bone starts creeping up, and it's going to impinge this muscle underneath that acromion. And this is most people's shoulder pain is because of this unstable shoulder, okay? And then they get all these impingement syndromes. But what you're doing is impinging the muscle, the arteries, the nerves, all these things that have to kind of run through this little gap here that are unable to kind of do that. So this is, again, most people, as they lift their arm up to the side or they abduct that arm, they kind of jam that bone up in here. And again, I can see that I just impinge all these structures underneath that acromion. Okay, so really, really, really important to keep those rotator cuff muscles really strong. And again, we talked about my shoulder has more motion than any joint in the body, and because of that, it does not get these big, huge ligaments that can give it its stability. It has to get them from the muscles. But again, my muscles have to be active, they have to be healthy, they can't be injured, they can't be fatigued in order to give me the stability. Okay, and shoulder exercises are really, really, really simple. We just have to remember to kind of do them. And if you guys have kids or you have anybody in your family that's going to play baseball or any kind of racket sport or swimming, they're prone to these shoulder injuries, and they want to start doing these shoulder exercises really when they're really young before they start to have all these kind of issues. So here's a picture of the forearm, okay? And I'm not going to ask you a ton of questions about the forearm. What I really want you to kind of get from the forearm is I want you to realize that, okay, these are all my flexors, okay? So if you hold your hand and you put your palm up, okay, and then I kind of curl my wrist, that's going to be flexion of my wrist, okay? And what you're going to find is that all the muscles that flex my wrist, okay, and they're going to be on the anterior. This is the anterior part of the forearm. They're going to all come up, okay, and they're going to attach on that medial side, okay. So they're going to attach on the medial epicondyle, or that medial side of my elbow, and that's really what I want you to kind of concentrate on. And then what happens with the extensors is they're all going to be on the posterior side, right, or the back part of my hand. And what's going to happen with them is they're all going to come up and attach on the lateral side, or that lateral epicondyle. So I can tell based on where my pain is sort of what muscles are working kind of too hard. And for these ones, I really just want you to focus on, okay, what's a flexor, what's an extensor. And again, you don't have to kind of memorize all these and kind of label them. The name kind of tells you where they're going to go. So if it's a digitorum, it's going to go into the fingers. If it's a carpi, it goes into the wrist. For us, again, we're just going to concentrate on flexor, extensor, and then we're going to know what side they're on, right? So if they're on the thumb side, they're going to be radius. If they're on the pinky side, they're going to be that ulna. So again, I can kind of break them down based on where they go, just based on looking at the picture, okay? But for us, we want to focus on just, okay, is it a flexor? Is it an extensor? Okay, and then here is why these muscles are important. And again, from this picture, I can see all these tendons that are trying to get into my hand. And this is one of the examples in your body where, all the muscles that control my wrist are actually going to be up by my forearm. They're actually more up by my elbow. And because I'm trying to control all these individual fingers, I'm going to have all these muscles and I'm going to have all these little tendons that go to all these different little parts of my hand. And I don't have room to put a bunch of muscles in here. So again, the muscles are going to be up by my elbow or in my forearm, right? But I have to cram all this stuff into my hand and through my wrist. And what happens is over time, if I use my wrists a lot, or I use tools, or I'm on the computer, or I'm doing a bunch of things where I'm using my fingers all the time, when these tendons, if you just take your fingers and you put them on top of your wrist and you move your fingers, you're going to feel those tendons kind of sliding. And what happens is I create a lot of scar tissue and inflammation. And eventually I kind of run out of room to kind of get my nerves and my tendons kind of into my hand, and I start to impinge all these nerves as they're trying to get down into those fingers. Okay, so this is carpal tunnel, which is really, really common, and this is something that's just going to get more and more common, especially now that you have all these little kids, playing the video games all the time. There's no way you can sit and play video games for 8 to 10 hours a day and not think you're going to get this sort of wrist problems and sort of wrist injuries. The problem now is that you're going to get them at 13, 14 instead of getting them at 25 or kind of 30. But you can see where I have to get this nerve into my hand, right? I have a median nerve, I have an ulnar nerve. The median nerve goes to like thumb and these two fingers. Ulnar nerve is pinky and ring finger. But what happens is you sort of impinge this nerve as it's trying to get through this little area in the wrist, and then I'm going to get a lot of numbness and tingling and weakness into these three fingers by the thumb, which is the main sign of carpal tunnel. Okay, but again, it's that I have to get the nerve in there, I have to get all the little tendons in there, and there's just not a lot of room, and any inflammation or scar tissue that kind of builds up is gonna cut off that blood flow and impinge that nerve as it's trying to get down into the fingers. So really, really, really important one to kind of keep those forearm muscles, especially those flexors, keep them really, really loose and make sure there's not too much tension in there. This is the back part again, we said. So I have all these muscles that are extending my wrist or sort of bringing my wrist back. They're going to come up and attach on that lateral side. And again, we're going to focus on the main muscle. So you just want to focus for the forearm stuff. What's a flexor and what is an extensor. Okay, and then these are the two things that kind of come with, again, we talked about carpal tunnel, but you'll get a lot of elbow pain, and you'll hear these called like golfer's elbow. You'll hear them called tennis elbow. Golfer's elbow is that medial elbow pain. Tennis elbow is the lateral elbow pain. People get both. So tennis players get medial elbow pain. Golfers players get lateral. It just depends on sort of what wrist position you're in when you're hitting the ball or you're using your racket and things like that. But again, it's just all the muscles that do the anterior side or do the flexion of my wrist come up and attach here. All the extensors are going to come up and attach on that lateral epicondyle. And anytime you have a bunch of muscles kind of going to the same area and they're all pulling on this spot, it's just very, very prone to kind of getting injured. And this is one of those just overuse injuries. So it's work, tools, certain sports, anything that you're holding in your hand all the time is going to make you a little more prone to getting these epicondylitis. And that just means inflammation of that epicondyle. Okay, and then this is what most people do. So what you can do is you can buy these little bands here, and the reason they're so cool is you can kind of get them anywhere. But you can see this is the epicondyle here. And what you do is, what I tell people to do is you do 3 fingers down, okay? So you find this bone, 3 fingers down, you wear this band, and then when you put the band on and you tighten it up, what it's going to do is it's going to change the insertion point of that muscle. And now the muscle is going to work from the band down into the forearm, and it's going to give this part a little bit of a rest. But the key is, you have to keep the band away from the bone, otherwise you're going to traumatize it and kind of compress everything against the bone. So you got to make sure throughout the day you're staying that 3 fingers down from the bone. Sometimes you even have people kind of draw a line on there so they can tell. And this is one where you want to get up and just put the band on right away. It's one of those where you don't want to wait until it's really sore and then put the band on. You're trying to prevent it from getting irritated and prevent that inflammation from kind of building up. So you got to use the band. You have to use the ice all the time. You got to watch your wrist positions, especially at nighttime. And again, you want to try to take as much stress off of these areas as you possibly can, because they can be, once they build up, anything you're holding with your hand, it can be really, really hard to kind of get back under control. Okay, but these are great, and they don't have to have magnets or any sort of electric stim in there or anything. It's just a simple, simple little band. But again, it just changes that insertion point and gives that top part of the muscle a little bit of a rest. Okay, the next thing we're going to do is move into the lower extremity. And then once we do the lower extremity, we're going to come back and we'll start looking at all the muscle physiology.